So let's go back to the slides about different steps, procedures. Can you see the slide?
Yes.
We stopped with which line? With the line C, right?
Yeah.
C. Yes, Roa, what about line D? What should we use here?
Wash your hands and put in sterile gloves.
Exactly. Well, then if we look at the next line, Yara, please.
You want number F?
Number
Sterile the area of the patient back.
Okay, so this is sterilize the area, yeah? What about E, line E, about consent for the procedure?
Yes, I think it's obtain consent for the procedure.
Yes, this is obtain consent for the procedure. And then G line about the equipment on the trolley.
You want for me to answer?
Yes, please.
Okay. Prepare the equipment on the trolley.
Yes, and the manometer, please. Attach the manometer. Okay, you can see that here all the lines are, the steps are mixed. So here they are. Just withdraw the stylet, drain 10 drops of cerebrospinal fluid into the 3 specimen tubes. Mark the point, then wash your hands, obtain consent, sterilize the area, prepare the equipment on the trolley, attach the manometer. So if we think about the correct succession of actions, of steps in the instructions for a procedure, what will be the first step? What should we do first?
I think wash the hands.
Okay, yes.
And use gloves.
Yes, this is
Prepare
very...
the equipment.
Then prepare the equipment.
Prepare the equipment.
Then if we compare these 2 steps, washing your hands and putting on sterile gloves and preparing the equipment. So can we first prepare the equipment on the trolley and then put on the sterile gloves?
Yes,
so
maybe prepare the equipment first.
Yes, because we need to insert the needle inside the patient's body. So,
but doctor,
yes?
I think we should hygienic our hands before we prepare the trolley.
Okay.
Maybe in our hands there is a bacteria or viruses.
I agree. It means we can separate this step, like you wash your hands, prepare the equipment on the trolley, do something else, and when you touch the needle, before touching the needle, you should put on sterile gloves, right? Like this. Okay, so the other step, if we've prepared everything and we've done everything with our hands,
maybe
obtaining consent for the procedure from the patient,
yes.
right? So I would just speak to the patient before the procedure, before starting the preparation. Like I think it's very important to obtain the consent before we start doing anything. So I would...
Yes, because we should explain everything to patient before we start, to be everything is clear and the risk clear if there are any risk.
Yes. Well, okay, then So we've obtained the consent, we've washed our hands, prepared the equipment, and what should we do then?
Sterilize the area.
Which area?
The patient's back.
Do we need to sterilize the whole back of the patient or some point?
Just the lumbar part, because it's the lumbar.
So before sterilizing the area, we need to do what? To mark the
Mark the
point.
point.
Yes, first we
Yes.
mark the point between lumbars and 3 and 4 where the needle is to be inserted, and then we sterilize this area. Well, we've done this, then what should we do? Yes. This is the procedure itself, or
Drain.
Maybe
you remember that one of the instruments that is used here during this procedure, there are needles or tubes, specimen tubes, and manometer. If we think of the function of the manometer, why do we use manometer in this procedure? What does it help to do? Why is manometer used? What does it show?
I think, maybe I'm not sure. Maybe for the pressure of the blood or the pressure.
Yes, some pressure of the blood or some liquid. Yes, and before draining, so the liquid, so I guess we need to attach the manometer, or even at the beginning of the procedure, right? So yes, this is the beginning of the procedure. We need to attach the manometer, and then what is it?
Drain.
Drain
Drain.
the 10 drops of fluid into the 3 specimen tubes. Okay, and finally, what should we do?
Withdraw.
Withdraw the stylet. The stylet, this is the instrument that is used to drain the liquid, right? Well, you can see that some of the steps are missing here, but anyway, we can see the whole picture of the procedure just using only these steps. And what is the procedure itself? I mean, what kind of procedure is described here? What procedure do the instructions
I think
related?
they want to drain some fluid from the lumbar part of the back.
Exactly.
It's like
You're
a
right.
lumbar puncture, yes.
Yes, this is like lumbar puncture. So a procedure of taking fluid from the spine in the lower back through a hollow needle, usually done for diagnostic purposes, a spinal tap. And you can see here in the pictures where the needle is inserted. It's like, just to get the cerebrospinal fluid. And you can see the posture of the patient during this procedure of lumbar puncture. Okay, so this is that is just all I just wanted to discuss today with you. Now, if we focus on the test that we should take, well, now it's closed, but I'm going to open it. Yes, and one more thing. Before we start speaking about the test, I would like you to revise something. And so let's try to do it with the help of another presentation. Here there is a, well, this is a kind of a game which is called Welcome to the Questions Maze. So questions maze, this is Imagine that we are standing just at the entrance of a maze, and we need to get to the center of the maze. In order to do this, we need to to choose the correct answer to the questions to go the right way. So if you make a mistake, you might get lost. Well, and if we move to the next slide, so you can see that we have to choose whether to turn left or to turn right. So just to find our right way, we need to answer the question correctly. And the question is, which medical job involves implementing standard policies and procedures that keep the practice running smoothly? They supervise the facilities office staff, hire and train new staff members, and manage finances and budget operations. So, ladies, who knows? Should we turn left or turn right? Is it practice manager
Can I?
Left.
or general practitioner? Sorry? Yes?
Practice manager. Turn left.
Practice manager, turn left, okay. Can we turn left? Yes, you're right. Well, now we have 3 more choices, and we should find the right way. This is a person who greets and deals with clients and visitors to a surgery office, etc. Is it health visitor, receptionist, or practice nurse?
Can I?
Yes, please.
Receptionist.
Turn left.
Turn left, you think this is definition for receptionist, right?
Mhm.
Okay, yes, bingo. This is a doctor who treats patients with minor or chronic illnesses and refers those with serious conditions to a hospital. Is it general practitioner or midwife?
Can I?
Yes, please.
Straight ahead.
Straight ahead. This is general practitioner. Yes, you're right. This is a trained nurse who visits people in their homes to assist or advise the chronologically ill or parents with very young children. Practice nurse or health visitor?
Can
Yara?
I?
Prac-
Yara?
Okay. Turn right.
Right.
Health visitor.
Yes, you're right. Okay, this is a person, typically a woman, who is trained to assist women in childbirth. Is it midwife, receptionist, or practice manager?
Can I?
Ibrahim?
Midwife.
Midwife. We should go straight ahead. Yes, okay. Now, this is a nurse who visits and treats patients in their homes, operating in specific area or in association with a particular health center. Is it practice nurse or district nurse?
Can I?
Yes.
District nurse, maybe?
Are you sure?
Maybe.
No,
Okay.
it's
I don't know.
Yes, okay, you're right. Now, the next definition, this is a registered nurse based at general practitioner surgery office practice who works with the GPs to care for the patients seen at the surgery. Is it district nurse, general practitioner, or practice nurse? Where should we go?
Practice nurse. Turn left.
Okay, yes, it works now. This is a chronological, written account of a patient's examination and treatment. That includes the patient's medical history and complaints, the results of diagnostic tests and procedures.
Can I?
Yes, please.
Patient records.
Patient records. Yes, correct. This is the list and description of the health problems and issues experienced by the patient, resulting in the attendance. So why the patient has come. Is it hospital number presenting complaints or patient's patient records.
Can I?
Yes, please.
Can I?
Yes, yes,
Presenting complaints,
sure.
Turn
Yes.
left.
maybe.
Okay, let's see. Yes, you're right. And now about conditions. Which condition do you associate with a sharp pain at the right side of the stomach? Whether it's appendicitis, tension, headache, angina pectoris, what is it? Yes,
Appendicitis.
appendicitis. You think we should go
Yeah.
straight ahead? Let's try to do this. Yes, and now I think it's the last one. Which condition refers to pain that radiates along the path of the nerve, which branches
Can
from
I?
your lower back through your hips and buttocks and down each leg? What is it? Is it ureteric sciatica?
Yes.
No, it's not the last.
No.
Now, which condition do you associate inflammation in the stomach causing belly pain, indigestion, bloating, and nausea? Gastritis
Can
or
I?
cholecystitis? Yes, is it?
Gastritis.
Gastritis. Straight ahead.
Yes. Yes.
Yes, congratulations. You found the center of the maze. So we've revised some medical terms and we know everything. I think, well, it will help you in the test. And if we go back to the information about the test on the slide. So now the test is closed, but I will just now go to the site, log in the Moodle site and change the settings, and you will see the test. You will see it in the current week. You will see the presentation there. And so it's called General Medicine Midterm 1 Test, year 2022. So, the test covers the topics and grammar structures that we studied in units 1 and 2. And there are 35 questions. There was a question about the types of questions. A lot of questions that are multiple choice questions. It means that, for example, you can say a sentence with a gap, and you should decide, and then below the sentence there are 4 or 5 versions that the phrases, the grammar forms that should be used in instead of this gap. And so you choose the best grammar form that so we need to use in this sentence. Most of multiple choice questions are grammar just questions. You need to understand which form is better to use in each of the sentences. There are several true-false questions. You read the statement and you should decide if the statement is true or false. You agree or disagree with the statement. Then there are several matching questions. For example, there are several definitions given. And if you click on a definition, you will see the pop-up menu, and in the menu, you will see some explanation of the term, and you should choose the best explanation for each of the terms. So this is, you match the terms and definitions. Then you can also, there will also be some select missing words tasks. This is like you see the text with the gaps. When you click on a gap, you will see also the pop-up menu, and you will see the words that just several options, and you should choose the option which best suits this gap, this sentence. Well, and don't forget to click the save button or submit button. I don't remember actually. And so you have 50 minutes to complete the test. And one more thing, it means that this is the time now in Almaty, 10:30, about 10:30. So the test starts at 10:30, and you'll be given the time limit of 2 hours. It means that the test will close automatically in 2 hours at 12:30. If you haven't completed the test during this time, it will close and you won't be able to finish the test. It means you should start immediately now after this session. So, and one more thing, when you start the test, you will see the countdown time on the screen. So, and you will see how much time left till the end of your test session. Is everything clear?
Yes, doctor.
Yes, doctor. Thank you.
Okay, good luck to you. See you next week. Yes, during our class. Bye-bye.
See you, doctor.
Thank you.